I'm the named GP for patients with learning disabilities in this practice, and I love this role. And I'm greatly influenced and guided by the Primary Care Liaison Nurse in helping these patients through very difficult times. During times when they are cared for by their family or by their appropriate carers, things tick by smoothly. But when things go wrong and they develop an underlying condition, it becomes completely impossible for them to get the health care. And with the help of the Primary Care Liaison Nurse, I think this would be completely impossible. She facilitates access to the Community Learning Disability team and will expedite and oversee referrals. She provides training for a named GP and a nurse and for the whole practice in order for us to make these needs aware and to help us how to make these patients, access healthcare better. She is very easy to contact and will signpost these patients to the relevant healthcare professionals, and she will support them on other ways as well. So she will actually attend hospital appointments, surgical procedures and outpatient scans and investigations. So she knits together this very important framework of people involved in the patient's life to ensure maximum quality of care is delivered to the patient. We have a register of patients with learning disability, and we have a named GP and a named nurse who then organises an annual healthcare check for these patients on the register. To access the healthcare, we have organised longer appointment times. We arrange home visits suitable for the patient's needs. So, for example, they will attend the daycare centre and then we will see them afterwards. So it's all relative to the patient's needs. And I think this has actually ensured that the patient and the carers are able to develop rapport with us a lot more easily and access our practice and healthcare because of that. Otherwise, they would find it very daunting. I think the annual healthcare check is paramount to improving the healthcare needs of these vulnerable patients. The patients are reviewed in all domains of health, including mental, physical, emotional and social on a yearly basis by the named GP and the nurse. It's ensured continuity and familiarity and the ability for the named GP to be able to pick up any underlying healthcare needs of that patient and also any support needs for the carer. So, for example, we had a 44-year-old male with Down syndrome living with elderly parents. Unfortunately, his mother developed a serious illness and was in hospital for several months, and then she passed away. His father developed a terminal illness and could not be the sole carer for the patient. The patient himself developed a medical health condition that required hospitalisation, surgical procedures and lots of outpatient investigations. The Primary Care Liaison Nurse, first of all, rearranged another family member to come and care for him in the meantime, and she liaised with all the hospital specialists, the family and ourselves in order to make his treatment quite smooth. The outcome was very successful. The patient's medical condition was successfully treated, and he's attending his daycare centre and is being cared for by his sister at home as though nothing had happened. The Primary Care Liaison Nurse liaised with all the multidisciplinary team. She arranged meetings with the hospital specialists, best interest meeting, involved the family very heavily, involved ourselves. And without this and without our involvement in decision-making processes, the outcome wouldn't have been so smooth.